Greetings to the Rhode Island community of the deaf and hard of hearing. Welcome to today's COVID-19 update for 2022. There are two topics that I will be addressing. I will be addressing the updated Bivalent Booster, and we will be discussing whether or not you are considered up to date pertaining to the boosters that you already have or your vaccines. However, before I begin, I just want to let you know that I have been listening to much of the feedback that you members of the community have given me, asking me for a more an abbreviated version rather than a long, drawn-out explanation of a lot of the information that's been given in reference to the COVID updates. So I've decided to do so. And so after this presentation, if you still feel that you need to contact me, please feel free to do so. So, historically, COVID-19 is still alive and among us as we, live and breathe today, going into its third year. This March will be the third year that this virus has been around. So we are not out of the woods yet because we still live with COVID among us. Now, Rhode Island, what we consider our community level, is considered very low and has been low for the last couple of weeks, and that's pretty good news. Okay, so Rhode Island has really stepped up in terms of keeping that low spread of this infectious disease. Now, when we talk about the Omicron, we talk about the vaccines that we've had that help protect us from these Omicron variants that have mutated. Now, you have probably noticed a new terminology that showed up that has been known as the Bivalent Booster. Now, historically, they were just called boosters. Vaccines basically referred to your first and second series of shots, and then the third one was considered the booster. But now we have a new terminology or a new word known as the Bivalent Booster, which began as of September the 1st, 2022. And so you may be wondering, what does this bivalent booster mean? Well, since the onset of COVID-19, there have been about 10 different mutations that have taken place from the original version. So the variant one, the first one was known as an alpha, then there was a beta, and so forth. And then it went on to be called different names according to the variant's changes, which is listed right here behind me. So these 10 variants that have taken place have all mutated over the last couple of years. Now, the booster that we normally had protected us from these difference of variants that have mutated, with the exception of the last two, the Omicron BA.4 and the BA.5. Those have been very, very strong variants that have been resistant to the traditional vaccines and boosters that we've had from Moderna and Pfizer. So now the CDC, along with the pharmaceutical companies of Pfizer and Moderna, have been working on a new and improved booster, which is now known as the Bivalent Booster, which is more combative and more protection against these two last variants that have just come up. And they have become available since September 1st of 2022, which has now been in effect for about the last 2 or 3 months. Now, you may be wondering that the CDC is reminding people, that, you have already received your booster, but the thing is that if you received your booster before September 1st, you received a booster that was known as a monovalent booster, which means one booster, which would protect you against all those variants, with the exception of the last one, the Omicron BA.4 and BA.5. So this new variant that come up has now required us to make a new booster. So if you received the booster before September 1st of 2022, the CDC is encouraging you to get the new variant protective booster known as the Bivalent Booster, because winter is among us right now, and winter is the time that this virus does spread rapidly. numbers are expected to go up. So the CDC is encouraging everyone to go get their bivalent booster. And it's free. There's no charge. You can go get these at different facilities. Now, another topic that we want to talk about is the CDC is asking people, are you up to date with your vaccines and your boosters? So now we see this coming up all the time. People are referring to that. We see it in the, social media, in the paper, in the news. Are you updated or not updated? Well, the CDC's definition of being updated, it may be different from what you think is updated. So if you've gotten your primary vaccines, those first two, which was provided by Pfizer or Moderna, and also now a new third pharmaceutical company that's providing these shots is known as Nomovacs. Plus, in addition to those primary vaccines, they got the booster. Okay. But the bivalent is not among that. So therefore, you are not updated according to the new definition. So in order to be updated to the new definition of what updated means, you must have had your bivalent booster. So if you haven't had your bivalent booster, you're not considered up to date. Now you're probably wondering who's eligible to take these bivalent boosters. Well, any children or child from the age of 5 on up is eligible to take that shot called the bivalent booster. Any children or child that's under the age of 5 is not eligible to get that because there is no bivalent booster for anybody who's age 5 or under. Okay, but what is sufficient for those children who are 5 and under, their primary shots is sufficient for now. Now, who is providing the bivalent boosters? As of now, it is Pfizer and Moderna. Those are the only two. And it doesn't matter which one of those two pharmaceutical companies because it applies to the mix and match method. Regardless of what your primary shots were and your booster shots, you're eligible to take the bivalent booster from either company. Now, if you've just tested positive as of recently, the CDC says that you should not get the bivalent booster, but that you must wait at least 3 months from the time you tested positive with COVID-19. Then you can go get your bivalent booster. Now, I know this information can be quite confusing for many people. And as always, if you're unsure, you can always call your PCP, your primary care physician, or your private doctor or family physician, and have a discussion with them. And they will look at your vaccine records, and they will best advise you whether you are eligible or not to go get your bivalent booster. Now, if you've gotten your shot after September the 1st of 2022, then you probably did get your bivalent booster because that's all that was available at that time. Okay, but if you haven't, then you should go get that bivalent booster. And one other thing I would like to speak about, there may be some confusion about, who's eligible and so forth. Well, the CDC has created 2 new toolboxes that you can use on the Rhode Island Department of Health or the CDC Department of Health. And it's called COVID-19 Up-to-Date Tool. And it's a beautiful tool. So right behind me, as you can see, this is what it would look like when you populate that on your website. It has 2 boxes, and basically it'll ask you about your age. You will plug in your age. And then the second question will ask you about the status of your health, whether you feel strong or you're feeling, not so well or so forth. Once you put those answers in, it automatically populates whether you are up to date or not. So it does that figure for you automatically. Okay. Or it'll even tell you you need to go get your bivalent booster. So it's a nice tool to use. And the website to get to that is below here. This is under the Rhode Island Department of Health, their website. It's really a nice tool. Again, After going through that website and you're still not sure, reach out to your primary care physician. And then once you get your bivalent shot, you'll know whether you need it or not based upon the information that you got from the website or from your primary care physician. And as always, if you feel free that you want to speak with me or call me or send me an email, feel free to do so. My video phone number is as follows. Or you can send me an email at the following email address, which is follows below. Thank you. Stay safe and stay healthy during this winter season. Goodbye, folks.